With the vision of shaping global healthcare by spearheading the One Health initiative, the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, we are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As a market leader, we have a significant step towards reducing plastic burden by 160 tons per annum through introduction of eco-friendly packaging of our flagship brand Abhirab. As a part of corporate social responsibility CSR initiatives, we have adopted schools where IIL provides infrastructure support and basic facilities, including assistance with the midday meal program. The association with NDDB through the gift milk program, hundreds of school-going children benefit from daily milk nutrition. We also have donated an oxygen generation plant to Telangana Institute of Medical Science and Research Center during the COVID time. These are just few highlights about IL. For more information, please visit our website at www.indieimmune.com. Immunize with Pride is one of its unique initiatives with emphasis that vaccination not only protects individuals but also strengthens community immunity. Welcome to today's episode of Immunization Conclave. This session is dedicated to highly significant topic, hepatitis A in adults, who is at risk and how can we prevent it. It's my privilege to introduce our panelists, Dr. Amit Prakash Srivastava, Dr. S.C. Panigrahi, and Dr. Motij Kumar Dalai, leading gastroenterologist and hepatologist. It's my pleasure to introduce Dr. Amit Prakash Srivastava, a highly respected gastroenterologist from Lucknow with over 23 years of experience. He completed his MBBS and MD General Medicine from Banaras Hindu University, Varanasi, and holds a FIMSA and FACG from USA. He is currently Assistant Professor, Department of Medicine, Unit of Gastroenterology at Lucknow Motij and Senior Consultant Gastroenterologist at Midland Hospital, Lucknow. Welcome, Dr. Amit Prakash Srivastava. It's a privilege to have you with us today. It's my pleasure to introduce Dr. S.C. Panigrahi, an eminent gastroenterologist and hepatologist from Bhubaneswar. He is a professor, Department of Gastroenterology, KIMS, Bhubaneswar, and the gold medalist with MD, DM, and DNB qualifications. His expertise includes gastrointestinal disorders, liver and pancreatic diseases, and advanced endoscopic procedures. Welcome, Dr. S.C. Panigrahi. It's a truly privilege to have you with us today. We are honored to have with us Dr. Motij Kumar Dalai, consultant gastroenterologist, hepatologist, and therapeutic GI endoscopist at Kalinga Hospital, Bhubaneswar. He completed his DM gastroenterology from Lokmanya Tilak Municipal Medical College and General Hospital, Mumbai, and his expertise in gastrointestinal, liver, pancreatic, and biliary disorders, advanced therapeutic endoscopy, ERCP, EUS, and hepatology. He is actively involved in clinical research, medical education, and public awareness. Welcome, Dr. Motij Kumar Dalai. It's a privilege to have you with us today. Welcome, doctors.
Hello.
Hello. Sir, let's all begin today's session with most commonly asked questions on the today's topic. So my first question is to Dr. Amit Prakash Srivastava. To begin, could you help our viewers understand what hepatitis A is and why are we seeking it more often in adults rather than only in children?
Okay, this is a very common question. I think hepatitis A is an acute viral infection of liver caused by hepatitis A virus. It is transmitted primarily through fecal oral route, contaminated waters, and food. And unlikely hepatitis B or C, hepatitis A does not cause chronic liver disease. And the most people recover completely with lifelong immunity. However, in some adults, especially those with pre-existing liver disease, it can lead to severe even acute liver failure. Traditionally, was considered a childhood infection in countries like India because children were exposed to the virus early in life through poor sanitation. Most infections in children were mild or asymptomatic, and they developed lifelong immunity naturally. With improved sanitation and better hygiene and access to clean drinking water, many children are no longer exposed to virus at the early age. As a result, they could grow into adolescents and protect antibodies. And these susceptible adults become infected. Disease is usually much more symptomatic and can be significantly more. This is the main reason hepatitis A infants and adults rather than in young children. Better sanitation has reduced childhood exposure, but it also susceptible adults and making adults hepatitis A an increasingly important public.
Very well explained,
I
sir.
think this is the
Like you have mentioned very clearly, why is it in more common in adults and also in adults that all and in children. So my next question is to Dr. Motij. Sir, how does hepatitis A spread among adults, and what are the most common sources of infection people underestimate? Food, water, travel, or contact?
Yes, sir has already mentioned beautifully that hepatitis A is predominantly a fecal mode of transmission. So, mostly
Spread among adults. What are the most common sources of infection people underestimate? Food, water, travel, or
raw fish that is consumed throughout a country. So, this is the commonest site, way of contaminating hepatitis A. Apart from that, as we know, hepatitis A does not cause severe disease in all. Those people who are infected, and especially the people who are in close contact with the infected people, are at high risk of having hepatitis A. Apart from these, people traveling to the areas which is poor in sanitation and have high incidence of hepatitis A. Those are the people at risk of having hepatitis A. And the most common thing that we ignore is the food handlers. Throughout our country, we take street food, and the people who are handling this food are usually those who do not follow adequate sanitary measures. So, if any one of these people are having hepatitis A, they are likely to spread hepatitis A to a very big population. So I would not say one way of hepatitis A is bigger than the other. It is a collective way of all, that is contaminated food, food handlers, close contact persons of infected people, and at last, but not the least, traveling to a endemic zone.
very well said, sir. Traveling is a very big concern, and it happens. The infection spreads through that. Thank you for mentioning in that point. So my next question is to Dr. Amit. So many adults confused hepatitis A with hepatitis B. Could you clearly explain the key difference between them and why adult may need vaccination for both?
this is a very common question. Although both hepatitis A and hepatitis B affected the liver only, they are caused by different viruses. And Their mode of infection is hepatitis A is fecal oral route, mainly by consuming contaminated food or water through close and affected person. It causes only infection and does not become. Most patients recover completely and develop lifelong immunity. B is transmitted through blood, such as from mother to child at birth, unprotected sexual contact, sharing contaminated needles, or unsafe blood transfusion. Unlike hepatitis A, hepatitis B can become chronic, leading to cirrhosis, liver failure, liver cancer if left untreated. Vaccines is available for both diseases, but they protect against diseases. Receiving one vaccine does not protect against other. Adults who have never been vaccinated or have no immunity may require vaccines depending on their risk factor. Hepatitis A vaccination is especially recommended for people with chronic liver disease, travelers to endemic areas, food handlers, healthcare at risk. Hepatitis vaccination is recommended for all unvaccinated adults who are at risk, including healthcare workers, people with diabetes, those with chronic liver disease, patients on dialysis, household of and other with potential exposure blood or body fluids. In symptoms, mainly food and waterborne infection that cause acute illness. B is blood-borne infection can become lifelong and lead to serious liver complications. Battles against both through vaccination is an important step in preventing liver diseases.
Thank you, sir. Thank you for mentioning a very good point. So my question is to Panigrahi. Like, welcome back, sir. Welcome back for joining. My question for you is, sir, am I audible? Yes, sir. So for your, I have a question for an adult who has already been vaccinated against hepatitis B, but not hepatitis A. What is your advice? And is combined hepatitis A and B vaccination is a good option? Uh, I guess Dr. Panigrahi is having a technical glitch. So my next question to Dr. Motij, from a gastroenterology perspective, how do hepatitis A and B differ in their impact on the adult liver, and how effectively do the vaccines prevent these outcomes?
Very good question. As I think Amit sir has already mentioned, hepatitis A and B are totally different diseases, and also the mode of contact of hepatitis A is fecal, and B is basically via serum. So hepatitis B goes through three stages. Basically, once it has come into the body, it can either have acute hepatitis, which occurs in very less percentage of people. Less than 10% of people of hepatitis B have acute hepatitis. Majority it is chronic liver disease. Around 80 to 85% will have chronic liver disease, and during and some percentage of people who are having chronic liver disease will develop cirrhosis and subsequent hepatocellular cancer. Very interesting thing is that hepatitis B vaccine that is freely available in universal immunization program is very much effective in preventing all forms of hepatitis, acute, chronic, and also hepatocellular cancer. And it is very effective. More than 95% of the complications can be prevented by a hepatitis B vaccine. On the contrary, hepatitis A has a fecal route. Mostly majority of the patients have a self-limiting kind of illness. Only 1 to 2% of people develop permanent liver failure, and up to 10% of people, those who are having, especially as you mentioned, adults, the people at the age beyond the child age, if they contract hepatitis A, are at high risk of developing a protracted jaundice and recurrent jaundice that is last for months together. And some of them can have acute liver failure. So hepatitis A vaccines is very good vaccine which can prevent flares of acute hepatitis A. And also we can protect people from going to complications like a protracted jaundice or a fulminant hepatic failure.
Thank you, sir. Thank you for mentioning that. My next question is to Dr. Amit. Which group of adults are especially high risk of hepatitis A today? Travelers, food handlers, healthcare workers, people of liver disease, or others? Any other category can take this vaccine.
Okay. While anyone who is not immune to hepatitis A, certain groups of adults should be travelers visiting areas where hepatitis A is very common. Second, people as hepatitis B vaccinated. Third, health workers, especially those who are working in our department like gastroenterology department, many department. Fourth, food handlers. Uh, Other high risk like group include when you have when people who use recreational drugs, drug abusers, users, or live in crowded conditions. And most common, I think, people's by like health workers and the persons are who are food handlers are very common. In addition, people with clotting disorder, clotting factors, concentrates, and laboratory personnel working directly with hepatitis A virus should also be vaccinated. Uh, Adults with chronic liver disease, international and high risk groups should not wait until they are exposed. Vaccination is the safest and most effective way to prevent hepatitis A and its potential serious complications. So persons like food workers, the right person should get vaccinated by hepatitis A vaccine.
Yes, sir. Thank you. So my next question is to Mr. Dr. Motij. Sir, what are the typical symptoms of hepatitis A, and how these symptoms become dangerous in adults compared to pediatric cases?
Typical symptoms of hepatitis A. Hepatitis A follows 2 to 3 cycles. Number one, sorry, stages. First, as there is an incubation period of roughly 2 to 3 weeks. After that incubation period, people have a pre-icteric stage. That is, they have prodromal symptoms like fever, malaise, easy fatigability, myalgia, and they can have vomiting in this period. As this period usually lasts somewhere between 1 to 2 weeks, and by the end of 1 week, gradually they start developing jaundice. So once jaundice comes, all the symptoms go away. Jaundice peaks over few in another couple of weeks. So the entire cycle of pre-ecteric, ecteric, and post-ecteric stage is usually one and a half months in majority of children or some adults. But certain adults, we see that they develop a protracted course of jaundice that lasts beyond 1.5 months. So these are the people course of jaundice, those who develop coagulopathy of ordinary bleeding tendencies, ecchymotic patches in the body, and those who develop altered sensorium, that is, they are not able to recognize anybody and gradually over a period of time go into a state of coma. So these is suggestive of a permanent liver failure. These are the people who might need liver transplant as going ahead. So, albeit this percentage of people having these symptoms is less, very less, only 1 to 2% have these symptoms. So, one should be very careful when they develop out of ordinary sleep, unusual bleeding tendency, or a very protracted course of jaundice lasting for a long period than expected. So, whenever people have these symptoms, we will be very careful about a severe form of hepatitis A.
Thank you, sir, for saying that from 1 to 2% patients may end up with the liver failure and they get into liver transplantation. Thank you for saying this to our viewers. So, my next question is to for Amit, sir. Sir, what role does hepatitis A vaccination play today, and which category of adults should strongly consider this and have to get vaccinated?
Hepatitis A vaccination has become increasingly important for adults because many people today have not acquired adequate immunity have improved nowadays. Fewer children are exposed to the virus, leaving a large proportion of adults susceptible to infection. Since hepatitis A is generally more severe in adults than in children, vaccination is an effective way to prevent illness, hospitalization, and in rare cases, acute liver failure. Adults who should strongly consider hepatitis, I think people with chronic liver disease, uh, by hepatitis B or hepatitis C, fatty liver disease patients, or patients who are taking alcohol, international travelers visiting to other countries, health workers, food handlers, men who have sex with men, recreational or injection drug abusers, laboratory personnel, people with protein factor disorder, close household or sexual contacts person with hepatitis A, anyone with immunity who will be protected after discussing vaccination with their health worker provider. The current available inactivated vaccine is highly effective and is given as a two doses schedule with doses administered in 6 to 12 months apart or up to 18 months depending on the vaccine. A single dose provides good short-term protections while completing the two-dose series offers of long-lasting immunity like at least 20 years and possible lifelong. If some countries in life at introduces single-dose vaccine is also available. Points are hepatitis A is a vaccine is for adults at risk, especially those chronic liver disease or those traveling to endemic regions. Vaccine is the one of the most effective way to prevent serious illness and protect. So
Thank you, sir. Thank you
hepatitis
for mentioning the schedule.
A vaccine.
A vaccine schedule. Sir, what do you say about the B vaccine schedules also, sir?
I think vaccine to that doses, 6 to 12 months apart. Maximum we can also give within 18 months, and it gives long-lasting immunity at least 20 years.
20 years. Okay, sir. Thank you for mentioning for the protection, how long the protection stays, because that is also very much important for the public to know before they take any vaccination. So my next question is to Dr. Motij. So for adults, any underlying diseases, already the patient is having any underlying gastro diseases or hepato diseases, can they also take hepatitis A vaccine, and how helpful it will be?
Definitely, as Sir has enumerated, so many people who are at risk of having severe disease. Purely from a gastro point of view, uh, people who are having chronic liver disease, whatever cause, and another set of patients which we see is inflammatory bowel disease, who are also taking a lot of steroids and other biological agents. These are the two group of patients who will definitely benefit from hepatitis A vaccine, and they can totally prevent severe liver disease apart from the natural course of liver disease which is already there. So I, as a gastroenterologist, will recommend these two population of people to definitely go for hepatitis A vaccine and protected from a very deadly disease of fulminant liver failure.
Thank you, sir. Thank you for mentioning that. So I have another question also to Dr. Motij. So as you mentioned, the other inflammatory bowel disease and also like a common diseases nowadays is a fatty liver disease. Then even diabetes, hypertension, even they are recommended to take this vaccine.
Right? In an ideal scenario, every adult should take it, but it is not available for free, just like any hepatitis B vaccine. So we initially will have to be very selective in patient. Definitely, the very high risk population, which sir has already mentioned, will be the priority. But apart from these, as you know, fatty liver disease, diabetics are immunocompromised. So it will be a very good idea to target these people and give them option to take hepatitis A vaccine. Couple of doses, 1 year apart, will be the way to go ahead.
Thank you, sir. Amit sir, my next question is to you. Beyond vaccination, what we have it, food, water, and hygiene. What are the precautions we have to take to avoid this infection, hepatitis A infection?
Vaccination is the most effective, but good hygiene and safe water, safe food practice remain equally important, especially during traveling or some outbreaks. Drinking safe water, I think preferably bottled, boiled, or filtered water. Eat fresh cooked like hot food, avoid raw and uncooked food like seafoods, especially shellfish. And wash your hand soap before anything. Maintain good kitchen hygiene by washing fruits and vegetables. Practice good sanitation and travel to endemic areas should get vaccinated at least 2 to 4 weeks before traveling. Avoid close contact with person, anyone who having hepatitis A infection. Uh, the message is that preventing hepatitis A require a combination of both vaccination and safe food and drinking water. Proper hand hygiene, responsible travel in practice. These simple measures not only reduce the risk of hepatitis A, but also help others food and waterborne infections.
Thank you, sir. So I have also one question. One more question is commonly question like when a child or an adult infected with hepatitis or any hepatitis, they get jaundice. So the parent or the adult thinks that once they get jaundice, they will be protected for life. Is it true? Is a myth or a fact, sir?
I think jaundice can be because of hepatitis A, hepatitis E, hepatitis B, and sometimes so. So first of all, we have to tell the parents that we have which infection his child has uh, developed. Okay, if hepatitis A or hepatitis B, we can prevent by vaccination, but there is, I think, no vaccination available for hepatitis C and as well as for hepatitis E. So, saying this is your child can be totally safe, he will not get jaundice after taking hepatitis A or hepatitis very much not right. At least 50% safety is there. At least your child, if get vaccinated for hepatitis B or hepatitis A, he will be protected from these two infections. So jaundice may be decreased by 50%.
Thank you, sir. So my next question is to Motij sir. Sir, if an adult watching this program and is unsure of his status, what is the single first step should he take this week? Testing, consultation, or vaccination? First, I'll be saying consultation.
Yeah, I think consultation will be the way to go for sure. One single test will be to go for anti-HIV test, either IgG levels or a total anti-HIV test. It is unfortunately not available easily in small places, but in any city you can easily get anti-HIV test done. If it is titers are very high, then there is no need for vaccine. But those who have negligible titers or zero, they should go for hepatitis A vaccine. So if you ask me one single test, I would say go for a total anti-HIV levels and go ahead with vaccinations.
Thank you, sir. So to all, both the doctors, the common question in one line, please give a message to our viewers. What exactly you want to say to their families and to the society? Amit sir, please.
I think vaccination are available nowadays. I think a few years back we had hepatitis A, as I know. So today we have the medicines available, and we have seen that we get immunity, lifelong immunity. 20 years is very good immunity period. So all the parents are advised by will get vaccinated for the child from hepatitis A vaccine. It's prevents lot of I think diseases. Lot of I think casual. I have seen if any person having any baseline disease like cognitive disease or some other problem, chronic problem, if he get infected with hepatitis A, it will cause better problems. Vaccination is very important. Yes.
Thank you, sir. Thank you for mentioning that. Dr. Motij, sir, yours.
I will have very simple saying that all jaundice are not the same. So if anybody has jaundice, best way will be to contact closest doctor and get tested whether it is hepatitis or some other cause. And since we are talking about immunization, I will mention prevention is better than cure. So as far as viral hepatitis is concerned, before we get any infection, better to go for immunization, whether it is hepatitis B or A or E. E is far-fetched for sure, but A everybody can do.
Thank you, sir. Thank you all for being a part of Immunization Conclave. I hope today's session was informative and valuable in spreading awareness on hepatitis A in adults, who is at risk and how can we prevent it. Our special thanks to Dr. Amit Prakash Srivastava and Dr. Motij Kumar Dalai for sharing their time, expertise, and insights with us today. Thank you so much, doctors. Thank you. For those who would like to revisit the program, the video will be available on our social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Please share the word as many of your friends, family, and relatives. Until we meet in our next live talk. Stay healthy, stay aware, and please take good care of yourself. Thank you so much, doctors. Thank you for being part of this.